Welcome everyone to the Thrive series. My name is Elsie, and on behalf of the Thrive planning team, I'm happy to welcome you to the Fall 2023 series. If you have attended a Thrive program before, welcome back. If you are new to the series, we're so happy to have you here. We were delighted to have such a great session last week and are looking forward to the next several weeks with you all again. The Thrive program is a collaboration between mHealth Fairview and the Masonic Cancer Center at the University of Minnesota. We are proud to offer 6 sessions this fall. Today is the 3rd session, so don't forget to mark your calendar every Tuesday at 6 p.m. You can pick and choose sessions to attend and rewatch the sessions on our website at z.umn.edu/Thrive series. Before we get started, I want to introduce you to the ladies behind the scenes. Over the course of the series, you can expect to see us all, and I think if you've attended all 3, you probably have at this point. Again, my name is Elsie Eldridge. I'm the events coordinator for the Masonic Cancer Center, and I will be co-hosting tonight's session with Holly Kreiser, mHealth Fairview Survivorship Nurse Coordinator. Also on the planning committee, but not present tonight, is Lissa Martinez-Hubner, Event and Administrative Manager at the Masonic Cancer Center, Amna Hussein, Masonic Cancer Center's Engagement Management, and Kaya Verich, mHealth Fairview Survivorship Program Manager. You will see Lissa, Amna, and Kaya hosting during the course of the series this fall. Now, I'm actually going to turn some things over to Holly to get us started.
Thanks, Elsie. I'm so happy to be here and to kick off our 3rd Thrive series of the season. Tonight, we will hear from Jeff Pounds, a psychotherapist at mHealth Fairview, on mental health and trauma related to cancer diagnosis and treatment. We will be recording tonight's session and every session so that you can refer back to the recording on our website at z.umn.edu/Thrive series. We do edit every recording before we post it to ensure your privacy. Before we get started, please take a moment to locate the mute and chat buttons. During tonight's presentation, please use the chat box to submit your comments and questions. At the end, Jeff will be available to answer questions, and at that time, you may also unmute yourself to ask your questions. If you are a University of Minnesota employee or spouse participating in the University Employees Wellbeing Program, Elsie is going to put a link in the chat shortly to complete the survey to mark your attendance today to earn your wellbeing points. All right, and now I will let Jeff take it away.
Oh, hello, and thank you for having me. I'm here to talk about trauma and cancer. And trauma is a very large topic, and we could talk for an hour on several of these pieces that I'm about to talk about. So I will launch into things. Trauma has become a focus for me and one of my main interests in doing therapy with people. Just to move into a little bit about me, I've been at Fairview or mHealth Fairview's Cancer Center at St. John's and Woodlands from December of last year to now. I also spent about 21-ish years at Fairview's dual diagnosis program, the mental health and substance abuse program. And then I also worked at mainly at Fairview Southdale from 2006 to 2018 in the ER there. And I've done some private practice on the side also. And then I've been in mental health since 1988 anyway. So I just wanted to mention some additional things before I get into more of the trauma stuff. I have no financial benefit from this presentation. The slides that I'm about to show are based on my observation, looking at research and my opinion in some cases. Also regard trauma as an event or chain of events that can cause trauma in one person and not in another. That's one thing. You know, two people can go through the same event, and one will have a trauma reaction, and the other person may not. So it depends upon the person. The case examples I'm going to talk about are real issues faced by the people that I see, but the actual people in the case examples are fictional. So cancer can be many people's worst fear. It's perceived as life-threatening. Being told you're diagnosed with cancer is a nightmare. Is a life-changing event, obviously. When I see people for therapy, they frequently talk about a paradigm shift and how they view life. So, generally as a society, we go around and we don't really think about our mortality, and being told you have cancer puts your mortality very much in your consciousness. People talk about that frequently that I see. And it's I think it's pretty easy to see how much anxiety it can cause. I mean, it's a we'll get into an existential fear eventually, but that's one of the things that people have to deal with is that. Um, um, Also, I realized when I was thinking about trauma, I veered off into some other mental health issues, which is I will include that as we go along about anxiety and depression. But cancer's associated with chemotherapy, with hair loss, with nausea, and some of the research I looked at said that 40% of the people experience significant emotional and social distress when they're told they're diagnosed. Moving into a definition of trauma. So psychological trauma is the overwhelming experience of extreme events that exceed a person's ability to cope and integrate those experiences. So the American Psychological Association, their definition, trauma is an emotional response to a terrible event like an accident, rape, or natural disaster. Immediately after the event, shock and denial are typical. Longer term reactions include unpredictable emotions, flashbacks, strained relationships, and even physical symptoms like headaches or nausea. And I'll get into more detail about that in a little bit. Trauma can be damaging to a sense of self. The bubble that we have around us can get damaged. And the traumatic event overruns our defenses to manage stress. Moving into, I get a fair amount of referrals regarding people that are newly diagnosed. Sometimes it can cause some of these things that I've listed. This is not an exhaustive list by any means, but these are some of the reactions that I've seen. Shock, disbelief, anxiety, fear, anger, a resolve to fight it, shut down, feeling out of control, having to rely on other people, or wanting a second opinion. People are sometimes, in terms of disbelief, why me? And then one thing that happens for some people is they have to rely on other people now. And if you're used to being the caregiver or being the one to help people, getting help from other people can be a challenge to accept. I talked with one person who was very much the matriarch of the family, and to have to accept help from people was really a challenge. And some people sometimes want a second opinion, which is understandable. And there's a feeling of a loss of control over their body and life, and in a sense that somehow your body is rebelling against you. So moving into a case, 71-year-old male finds out he has esophageal cancer. He's retired and worked in construction. has not ever seen a therapist. And that's one common thing I see frequently, is that people who have been diagnosed with cancer and referred to me sometimes have never seen a therapist before. So it's completely new to walk in and talk about your feelings and what you've experienced with someone. You've never done it. So this example, and he agreed to attend therapy. The wife is with him. Get him to start talking and open up, and he expresses fear about dying and leaving his wife alone. That's one of the biggest fears. And then cries through the session, which is fine. I'm glad he was able to let it out. And seen him a few times. And children are supportive, but it's really difficult to talk about the medical situation with them. He's found that when he talks about what's going on with him, that it leads to crying, breaking down. So, to keep things under together, he doesn't want to go there very much. So moving into stigma. Some people are referred, and the stigma of going to see a therapist might be a deterrent to coming in to see me. Sometimes people get called weak-minded or something like that, and I don't think that's the case, and it's not the case. So overcoming the stigma can be important, and be willing to attend therapy or take a medication. So sometimes it'd be hard to, accept the referral and to go in and talk to a therapist. Move into some different categories of trauma. Individual trauma, I titled it that way because there's some other types of trauma for cultural or generational trauma that I'm not going to get into, but again, we could spend a whole bunch of time on those also. So there's single event trauma, and then there's which is one, like a car accident. I've talked with people who have been in car accidents, and they have trauma symptoms from that. And then there's chronic or complex trauma, which is trauma over time. The chronic is more of the same traumatic events, and complex is a variety. But I wrote it like that because it's hard to really separate those, I think. And for people on cancer journeys, it's more of the chronic or complex trauma. Another thing that happens is called secondary or vicarious trauma, and that's for the people that are in the person's life that is going through the trauma. So the caregivers for a spouse, for the spouse that has cancer, that they see their spouse going through this, and it's really hard to it's traumatic to watch that. And it's okay to seek therapy. I know for the clinics here that it's okay for a spouse or a child to make an appointment to come in and see me or the other Jeff that works in our department. Statistically, 70% of people experience trauma in their lifetime. So it's something that is, I think, more out there now than it used to be. So that's a good thing, that people are getting more help than they used to. Um, some of the trauma that people experience from treatment, and I know that this is a cancer survivorship group, so some of you have been through these things. So, you know, the effects of chemotherapy, the, you know, loss of hair and nausea and things like that are things that are traumatic, and, you know, going through that. Um, uh, one person that I saw referred to radiation therapy as the treatment that just keeps giving. That you know, the after effects of the radiation most people don't know about, and that, you know, that really has affected her. Um, you know, another person actually this week was talking about immunotherapy and how fatiguing it is. There's a common uh, reporting of brain fog, et cetera, and that's really troubling for some people. Um, there can be a lot of there can be a lot of anxiety around scans. It can be scary, you know, leading up to the exam, and then our scan, and then having to wait for the appointment. You know, that's really can be a traumatic uh, thing for people to go through. You know, what are they going to tell me? And then prognosis questions. You know, how long do I have? Will I get better, et cetera? Pretty scary stuff. Um, Moving into another case vignette. Uh, a person going through chemotherapy, hair is falling out, and the person is traumatized. They don't want to leave the house because they don't want to be seen going, you know, going through that. Um, Also, you know, an issue is, you know, people have talked about when they first get diagnosed, you know, the friends are very supportive and around, and sometimes as time goes by, it kind of tapers off, and that has been troubling for some people, which is understandable. And then, like I talked about, the brain fog, and then there's fatigue, and you know, this person has to go through 6 rounds of chemotherapy, and so that's very, you know, very traumatizing for them, um, and so just another example of this person going through that trauma. Um, so trauma issues related to a cancer diagnosis, and I made this slide because of the sources. The American Cancer Association is one source, and the National Cancer Institute is another source. So, in terms of trauma and cancer, you know, uh, learning you have cancer, having pain or other physical problems caused by cancer, getting tests and treatments, receiving upsetting test results, long hospital stays or treatments, and the cancer's return or fear of its return. I you know, again, I see people quite a bit that you know, had cancer, were cancer free, and then it came back, and that can be really hard uh, to take. Um, so that was from the American Cancer Association, and then the National Cancer Institute. In survivors of childhood cancer, symptoms of trauma occurred more when there was a longer treatment time. So for kids, um, breast cancer survivors who had advanced cancer, long surgeries, or a history of trauma or anxiety disorders were more likely to be diagnosed with PTSD. So if, and I think I repeat this, but if you have a prior history of mental health issues, you're more likely to have possible trauma or PTSD from it, from the cancer diagnosis. So I have another case to talk about. This is a person who has a history of lung cancer. They were told they're cancer free, and they have scans every 3 months. And each cycle, we talk about the upcoming scan and how how anxious this person gets with that coming up. And so our goal is to work on distraction and calming, and so it's just kind of an ongoing kind of traumatic event for this person. So trauma factors that increase trauma symptoms related to cancer. So the next slide, please. Thank you. If there's a history of previous trauma, a high level of general stress can increase the risk of trauma symptoms. Lack of social support. There's a lot of evidence that social support is really important in mental health issues and medical issues, that having the support in your life is really a critical component. And I have a case vignette coming up that will talk a little bit more about that. So again, having prior mental health issues is a risk factor, and the use of avoidance to cope with stress can also increase trauma likelihood, or post-traumatic stress likelihood. So moving into the case vignette, this is a 40-year-old female with stage 4 cancer, and this kind of this highlights a level of general stress, so this person has multiple kids, and this woman is single, and the kid's father lives in another country, and so there's a lack of social support because she had 2 or 3 jobs, and the family is spread out across the country. Ex-spouse is in another country, and so financially it's been really traumatic for her. Electricity was turned off, but able to get some money to turn it back on, and then used other money to buy kids' school clothes. But the financial stress that people have to go through is very real, and can really be a problem. The next case is one second. Another woman who has cancer, and is getting treatment, but there's a complete lack of social support. And this person has autism spectrum issues, but lives independently, but is having to navigate her cancer journey on her own, including the appointments, treatments, dealing with the effects of the treatment and the after effects. So it's this person is trying to deal with all this on her own, and the family's not supportive. So it's really traumatic for her to deal with all of this independently. Moving on to some caregiver issues, and vicarious trauma or secondary trauma. It's difficult to watch family or spouse go through the illness and have fear for them. It's hard to watch that, and there's a change in dynamics in the relationships due to the illness for, chores, driving to infusion or appointments, etc. Um, you know, uh, people see loss of functioning or death. Um, it, sometimes the caregiver provides round the clock care, and people have to use FMLA or PTO or vacation time to be able to have the time off to go to these appointments and treatments, etc. It can have effect on socializing, and the caregiver can be at increased risk for PTSD. So moving into another case, 35-year-old male with prostate cancer who has had surgery. And I've seen people as young as mid 20s and people up into their 90s. So it kind of runs the gamut in terms of age wise. This person has a spouse who's uh, detached and distant and using alcohol excessively. It's really affected the spouse significantly, and the person going through the cancer, is dealing with it, and they don't want to. The spouse doesn't want to touch the person going through cancer, and that's causing sadness and stress for the person with cancer. So it's a secondary trauma, and the person with cancer is now spending a lot of time at family, and the spouse is now attending therapy. Um, so so it's an avoidant way of handling it, by using a chemical, or just staying away from the person going through the cancer. So so there was a question prior to this presentation about how do I support a family member going through a cancer, and these are my ideas, not exhaustive, but what I came up with. So to stay connected to them. Um, and one of the things that people have talked about in therapy is they would like to be allowed to do what they can. They might be fatigued, they might not be able to do as much as they can do, but they don't want everybody to do everything for them. So, ask what help, if any, they would like. Um, and then driving to appointments. Do they want to drive to appointments? Should they drive to appointments? How do you handle that? That's another issue. Maybe asking them, what would you like? They People also talk about wanting to talk about other things besides their illness, and ask questions, and they may or may not want to talk about it if you go into the cancer diagnosis. And I've talked to a number of people about starting a Caring Bridge site, and so you can post what you want to post about what you're going through, and not have to repeat it over and over. So moving into just general anxiety, which this medical condition can cause, restlessness, feeling keyed up or on edge, poor concentration, irritability, muscle tension, sleep disturbance, increased heart rate, sweats, trembling, feeling weak or tired, or just general symptoms of anxiety. Post-traumatic stress disorder used to be listed in the prior manual under anxiety disorder. So there's trauma and anxiety kind of go together, or they do go together. Also, people can go into a depression, and so some of the symptoms of that: low mood, irritability, poor sleep, too much or too little, appetite disturbance, either eating too much or too little. But it's hard to tease apart. Is the appetite disturbance due to treatment or to depression? So, and low interest in activities is another symptom. But if you're really fatigued, you're not going to have the same interest in activities. Another symptom of depression is poor concentration, and then suicidal thoughts is another depressive symptom that needs to be monitored and make sure people are safe. So therapy referrals, this is kind of a repeat. Many people do not accept the referral. They see symptoms as a normal reaction, don't really want to talk about it, don't want to be seen as weak. And again, unlocking those emotions can be really difficult to manage, letting them out. So that can be really hard for people. And there's also another question I saw in the pre presentation question list about what do you do with someone who won't talk about it? And I think, just sticking with them and maybe encourage them to, if they don't want to talk to family, maybe they want to talk to somebody else, a therapist or, a chaplain or someone, or, and then maybe check in with them about it and see if they might be willing to talk about it. Ultimately, you can't force people to talk about what they're going through, but continued encouragement. But I understand too that sometimes you might get a sharp retort about that. PTSD. I looked at several studies. There's a different percentage for through many of the studies. I saw 12 to 13%. This one in the Oncology Nursing Journal was saying 22%. So it seems to be, 10 to 22% is basically what I found. So what are the symptoms of post-traumatic stress disorder? Recurrent, involuntary, and intrusive distressing memories of the traumatic event that come into your mind without effort. They can just show up. Recurrent distressing dreams in which the content or affect of the dream are related to the events. So dreams that are about it. Dissociative reactions in which the individual feels or acts as if the traumatic event were recurring, and avoidance symptoms, avoiding people, places, things, and memories. Sometimes I was talking with someone who said that, they don't even want to drive by the hospital because driving by the hospital just triggers them significantly. So they stay away from it. They go around the hospital and not go right by it. It can lead to hypervigilance, being on edge, ready to react to threats, anxiety, which we talked about, irritability is another symptom, hyperarousal. So what protective factors might make it less that a person will develop PTSD? Good social support, like I talked about earlier, clear information about the stage of their cancer, and an open relationship with their healthcare providers. So having a good relationship with who's providing treatment for you is really important. I hear about it a lot. Those are some of the protective factors. So moving into trauma, mood reactions, sometimes, and a lot of these symptoms that I'm about to go through don't happen for everyone. It's just can happen for some people. An inability to experience positive emotions, feeling anxious, feeling depressed, or some trauma mood reactions. Dissociative symptoms or numbing is the next slide. And it's an altered sense of the reality of one's surroundings or oneself. Seeing oneself from another perspective or being in a daze, time slowing, also referred to as derealization and depersonalization. So people with PTSD often talk about being able to see themselves from outside themselves, or feeling like what they're going through is like going through a movie, that it's just kind of surreal. Also, sometimes people have a really hard time remembering the aspects of the trauma. So due to dissociative amnesia. Avoidance symptoms, effort to avoid distressing memories, thoughts, or feelings about are closely associated with the traumatic events. So you want to, that's a way of dealing with it. And then arousal symptoms, sleep disturbance, difficulty falling or staying asleep, restless sleep, from the previous symptom slide, if you're on edge, it can sometimes be hard to relax, obviously. Irritable behavior and angry outbursts, typically expressed as verbal or physical aggression toward people or objects. Hypervigilance, problems with concentration, and exaggerated startle response. So, jumpy. Some fears that are possible secondary to trauma. This is from a book, the Complex PTSD Coping Skills Workbook. And people can be suspicious of people, worry about being physically trapped, fear people will die, fear safety issues with your loved ones, worry others are mad at you, worry you're being watched or followed, and anger can be like just below the surface, can be secondary to the fear that they're going through. Some brain structures involved in trauma. The hippocampus is, and that's where the memories come in. And I'm not going to go into too much detail with this, but these are just some examples of some of the brain structures that are involved with trauma. So the memories, again, come into your hippocampus without effort, and your brain doesn't know at the time whether that's happening right now or if it's happening in the past, which causes the amygdala, or the alarm system, to get set off. And then the prefrontal cortex tries to use coping skills to manage the symptoms, but can be overrun by the strong emotional response. I looked at a couple different studies that talked about how adolescents with trauma histories, that their amygdala fires a lot easier, or the alarm system fires a lot easier, but their ability to cope actually decreases. So it's kind of a crossing, so you can see where that could cause some problems for them. So not so helpful coping strategies include, substance abuse, way to escape, avoiding others, staying on guard or hypervigilant, excessive anger, dangerous behavior can sometimes be a result, or avoidance, working too much. So some other stressful issues related to cancer, like I talked about in one of the case vignettes, financial stress. I hear about that quite a bit. Unable to work, trying to get on disability, which requires a lot of paperwork while you're not feeling not well, and the effects on the family. Again, existential issues, what happens after we die? Why am I here? What does it all mean? Those questions get triggered. Shock due to the new diagnosis or other event. Again, people can get shut down, become numb, blank stare. And then there's grief, which also, it's like trying to tease apart post-traumatic stress versus grief versus anxiety versus depression. People go through different types of symptoms, and what I focus on is trying to treat the symptoms, not looking so much at exactly what their diagnosis is. Of course, you want to keep that in mind, but you want to treat what they're actually dealing with. How am I doing on time? Am I about out of time?
I would say you have maybe about five more minutes, Jeff.
Okay. I understand that they're going to post my slides on the website. So I'm not going to get to everything. I got a bunch more slides, so you can get them off on this website. So another group of people that can be traumatized are the cancer professionals, the people that work with people at the cancer centers. We do some resiliency and preventing burnout presentations for them. So it can be overwhelming working in the field, and there's burnout and compassion fatigue. So that's another trauma issue. And again, we could spend a whole hour on that. So therapies for trauma, and I'll wrap up with the different therapies. So cognitive behavioral therapy, includes coping skills. And at the end of the slides, I list some of my favorite ones, which are breathing exercises, mindfulness, distraction, some other ones, and meditation. That's what I was trying to think of. And guided meditation might be a good thing to start with. And that's those things can be found on different apps. There's a bunch of different apps that are really good at presenting these things. And my favorite one is called Calm, CALM, and that has all those things on that app. There is a price for it, like everything, but I really like that app. There's also Headspace and a couple other ones. If you go to your app store, you can find those. Real new popular therapies, EMDR, eye movement desensitization, reprocessing, and ART, accelerated resolution therapy. That's using lights or buzzers or an orb going back and forth across the screen to make the amygdala fire while you're thinking of the traumatic thought, and then working on calming the amygdala through a script with the EMDR or ART. And I know that's a really brief explanation, and there's a lot to it. I am trained in ART, and I found that people watching an orb going back and forth across the screen while they're thinking of their traumatic thought, and then my going through the script on how to deal with that has been really helpful. And no, I don't think anyone knows exactly why it helps, but a neuropsychologist at Stanford did a study on it and found that these things are helpful for some reason. So, and let's see anything. Oh, prolonged exposure. That's kind of having people approach the trauma that they've been through or dealt with, and sometimes it's appropriate, sometimes it's not. But by facing what is avoided, a person learns that the trauma-related memories and cues are not dangerous and do not need to be avoided. So, like having someone go to the hospital, that has a avoidance to the hospital. And then psychotherapy is the last thing I'll talk about. It can be helpful for skills training, therapeutic alliance, being able to process emotions or issues that you might not be able to talk about with people in your life, and what you talk about can't go anywhere. It's private, so and for support also. So, like I said, my other coping skills are on the other slides, and I believe you'll have access to them. So, thanks for listening, and I can stop there.
Thanks, Jeff, so much. All right, you guys feel free to put some questions in the chat box. Just thanks again, Jeff, for all the knowledge and the amazing tips that you shared with us today. If any of the survivors listening want to see you or the other Jeff, what should they do? How can they request the visit?
Call the cancer center, one of the cancer center front desks, and just ask to be scheduled.
Okay, thank you.
Yeah.
Before we move on to some questions, I just wanted to let you all know that a survey will be emailed to you tonight. So don't forget to fill that out and submit it for a chance to win the swag bag. Let's see here. Okay, so I know you talked about a lot of this stuff already, Jeff, but if you could just reiterate, what should you say or how to help a family member with terminal cancer? Kind of any help or ideas with the right language to use?
Well, yeah, I think what can I do for you? How would you like me to help you? What do you need? And kind of let them direct what they need. Up to a point, sometimes they, if there's doctor orders on meds or whatever, yeah, maybe provide those for them without them asking. But I think letting the person direct and kind of be in charge of what they need is, if that's possible, is the way I would go.
Okay, thank you. And then I know you sort of touched about on this as well, but if there is a family member that's really closed off, not really wanting to talk about it or share any of their experiences or feelings, any tips on how to kind of help them talk and process some of what they're feeling?
Yeah, I think maybe checking in with them occasionally. Maybe they might want to talk about it eventually, but if they completely do not want to, I think encouraging them to see a therapist. And ultimately you can't force someone to talk that absolutely will not talk about it. But I think there's those things might be helpful. Those are my ideas. So.
Okay, thank you. Any other questions? All right, Elsie, I'll let you close us out.
Wonderful. Well, we're out of time tonight, but a huge thank you to Jeff for being here. As a reminder, the recording will be available on our website by the end of the week. You will also receive an email tonight with a quick survey to help us continuously improve. After submitting the survey, you can enter into the drawing to win that swag bag of all new stuff from the Masonic Cancer Center. We look forward to seeing you all next week, where we'll hear from Renee Levesque, who will be speaking about finding joy in nature. We hope to see you then. Thanks and have a good night, everyone.
Good night.